To put it simply, a chiropractic adjustment applies force to a joint that's fixated, locked up, or not moving properly. And what that does is adds motion to the joint, which helps the bones to gradually return to a more normal position and motion. And that means more movement and less pain. There are many different ways to perform an adjustment. Usually the doctor will use their hands or a specifically designed instrument to deliver a brief and highly accurate thrust-like movement. Some adjustment methods are quick, whereas others require a slow and constant pressure. After years of training and clinical experience, each doctor becomes highly skilled in a variety of adjustment approaches. Whatever the method, the purpose of the safe and natural procedure of chiropractic care is to allow better spinal function, greater nervous system function, and improved health. Well, according to the New Zealand government's inquiry, chiropractic care is remarkably safe. Chiropractic care has an excellent safety record, and that's because it's the result of a conservative approach to health, one that avoids invasive procedures and addictive drugs. The answer is no. In most cases it doesn't hurt at all. In fact, most people find having adjustments to be very relaxing. With some adjustments you may feel or hear a popping sound from your spinal joints. That's simply caused by a gas release from the joint as spinal movement is restored. The Chiropractors Association of Australia likens it to when a wet glass is removed from a table. The important thing to remember is chiropractors use skill, not force or strength, to conduct a safe, effective adjustment with your well-being in mind at all times. For more answers to commonly asked questions about chiropractic care, please watch the other short videos in our series.